Channel, and today we're going to show you a very interesting case which had a symblepharon between the cornea and eyelid. Here you can see this is the adhesion between the cornea and the eyelid, and this is called a symblepharon, and usually it forms between two surfaces of the conjunctiva, usually if the palpebral and so if this is the bulbar conjunctiva over, if this is the bulbar conjunctiva over here, this is the palpebral conjunctiva over on the lids over here. Usually if there's a defect in the epithelium over here, in the conjunctiva over this side, and there's a conjunctival defect over here, they will adhere to each other and fuse to form a symblepharon. So this is something which usually happens when you get a symblepharon, and there are different conditions which can produce a symblepharon. Out of them, the most common is a patient having a burn, which can be a thermal or a chemical burn. And then there are some genetic diseases which we'll discuss at the end, in which you can get granulation tissue formation and you can get formation of these symblepharon as well. Herpes simplex is another disease. If it causes extensive erosions of the conjunctiva, that can lead to this type of lesion. And let's see what it looks like on the slit lamp examination. And when you see on the slit lamp examination, you will need to pull the lid down, and here you will see the patient's cornea shows extensive scarring, and there is vascularization of the cornea in this area as well. So that tells you that the involvement is started off from a chemical injury which involved the limbus, and that led to the formation of this symblepharon, which you can see over here. And the important thing is you need to pull the lid down to get to see the symblepharon, and ask the patient to look upward. That makes it more visible, and you see these strands over here in this area, and this tells you that this is the actual symblepharon. And whenever there is symblepharon formation, you can also see there is some keratinization of the cornea as well. I was trying to see in the upper lid if there's any scarring of the tarsal conjunctiva, which is seen in another condition which is called ocular cicatricial pemphigoid. If we move forward, we'll see what development of adhesions between opposing epithelial surface is called symblepharon. As I told you, it's between palpebral and bulbar surfaces, but it can involve the cornea or the eyelid. And if there's adhesion between the two lids, that will be called an ankyloblepharon. And with that, you typically would see the formation of sort of a webbish sort of a thing whenever you see between two lids. If this is one lid and this is the other, that formation of that is called an ankyloblepharon. So that's different from a symblepharon. And the other